everyone. So as you guys probably know, you guys saw my foundation routine, the one where I showed you on my acne, and so many people told me go on Accutane. I talked to my doctor about it, and the problem is that I have premature rheumatoid arthritis in my knees, and due to that I don't have enough fluid, so I can't take Accutane because it will dry up my sebaceous glands. Basically, I'm not a candidate. But I'm here to talk to you about what I know, and hopefully if you guys are deciding to take or not to take Accutane, you'll be better informed with this video. So no, I can't take it myself. For everyone who's been telling me to, thank you for your feedback. I just can't take it. But for everybody who, you know, wants to know themselves or doesn't know a lot about Accutane, I will tell you a bit about it. First, starting off, the most basic thing you guys should know is that it is an acne medication. And let me look, what is it called? Accutane is basically the brand name of a drug called Isotretinoin. I don't really know how to pronounce it, but that's what it is. And as a lot of people know, the company actually shut down because of all the lawsuits. So Accutane does not exist anymore. They're completely gone. However, the generic drug still exists. So the potent chemicals that made Accutane are still out there, same stuff, only it's not a designer name. Think about it as a pair of jeans that you buy that have a designer label on them, right? Let's say they say 7 for all mankind. And you go to another store, buy the exact same pair of jeans, only they don't have the 7s on the pockets and they're not 7 for all mankind. It's basically the exact same thing, just fancier packaging. So it's the exact same drug, only one is manufactured by Accutane and much more expensive, and then the other one is just generic, which is basically the stuff in its purest form, depending on which one it is. Anyways, a lot of people take this for acne because it works very well. Basically what you do, you take it once a day, and it is going to dry out your skin. And it's basically pushing out everything and drying up your sebaceous glands so that you won't have acne. And what that basically means is that you have little glands in your skin, porous basically. Sebaceous glands are the ones that secrete oil, otherwise known as sweat, things like that. And what happens is that a lot of people that have acne have these overactive sebaceous glands in their skin, and they just overproduce this oil that gets caught. There's also hormonal acne. That's what I have. It's where there's imbalances in the blood and imbalances in the hormones that are not treated by sleeping on a clean pillow, not treated by topical stuff. It has to be treated by the mind, by basically hormone levels, by food, things like that. And I'll do another video showing you guys that, so be sure to check. But basically, what's amazing about Accutane is that it treats both. Accutane dries up these sebaceous glands, not just here, but all over the body. So you're not going to be able to sweat. Well, you will, but not very well. It's going to dry up your saliva glands, your lips will get dry. It will dry up basically every part of your body. Your joints, everywhere, they have fluid in them. It's called synovial fluid. And a lot of times with severe amounts of Accutane, this fluid will dry up. So basically your bones will get creaky. And a lot of people that I know that took it have had back problems, and that's why I can't take it, because of my knees. Because I have this arthritis, if that joint fluid just dries up, all that's going to be left is bone and cartilage and a couple ligaments. And those are just going to grind against each other, cause a complete flare-up, and I'm going to be disabled. So that's why I can't take it. But basically that's what Accutane does, and because it dries up those glands so much, can you guys see me? Am I focused? Dries up those glands so much, it's going to stop you from producing oil. Now this is good to get rid of the acne, but at the same time when you get older, you're not going to have as much oil in your skin, you're not going to have as much collagen in your skin. And basically oil and moisture when you get older is what is going to make you stay looking young. So why, if the sebaceous glands are treated by Accutane on the surface, why does Accutane treat hormonal acne? Well, hormonal acne is of course through the blood, but what happens is that Accutane, when you take it, actually changes your DNA structure. And that's what causes the dryness, the flakiness, there's no oil, etc., etc. It's drying up these glands, telling them to go away, but it's also stopping good blood flow to your skin. So basically it's constricting things, it's changing your hormones. A lot of people say they have suicidal thoughts. There was a story about a boy. He was on Accutane, and he was a normal, happy guy. He ended up killing his doctor, and I think a couple other people, and they were trying to blame it on Accutane because of all the psychological side effects. Side effects are hallucinations, side effects are imagining things, and A lot of people says that that's mental stuff, you know, the drug. Basically what that is the drug messing with your hormones. It's lowering your dopamine levels. Dopamine is what makes you happy. It's a hormone. And Accutane lowers those dopamine levels, which can make a lot of people depressed or even suicidal. So it is basically messing with different hormones, and that's what can stop and kind of help with a lot of the hormonal stuff that people go through. The reason that Accutane was taken off the market is because of all of these side effects, and so many people have been having them that there's so many lawsuits, they just kind of quit and said, we are done. So everybody else kind of has to deal with it. Basically, in order to be on Accutane, if you're a woman, you have to have 2 forms of birth control, not just 1, but 2. It's either 2 different birth controls or all sorts of stuff, because it can cause, basically it dries up the uterus, ovaries, you know, everything like that, and you can't have a normal baby. And because of the mental stuff, the hormones, it's just detrimental to a fetus or an unborn child. So you have to be really careful when taking it. You have to get like weekly checkups, all this stuff. And I'm not exactly sure. I see some results that are great, and I see others that are terrible. People have claimed that they have less drive. People have claimed, you know, of course, thoughts of suicide, hallucinium, delirium, all sorts of things. And that's not honestly something I really want to go to. So yes, treating my acne is hard, but basically, acne needs to be treated by the source. So doctors say, oh, the source is the sebaceous glands, because that's where the oil comes from, right? So let's get rid of them. What should be treated is why your sebaceous glands are so overreactive. Let's not just dry them up. They're there for a reason. We're going to need them. My personal opinion is we should look into why we're, you know, getting hormonal acne. Why is our blood imbalanced? Is it our diet? Is there something in our environment or our air? Is there a hormone or stress issue? You know, and treat that. That will treat the blood, which will fix the problem, instead of just, you know, kind of going at it with medicine and stuff. Anyways, Accutane usually lasts 6 to 8 months depending on the client and what their needs are. When you go on Accutane, or, you know, this generic drug, you can expect to see peeling and flaking and all sorts of stuff. And there's actually a list of side effects, and I will read some of them to you. If you guys want to see this, it's going to be crazy. Just a few things I'm going to mention before I get into the side effects. Accutane, also known as Roaccutane in places like Brazil and some other countries. There's a couple of other things that it does. It says here that it dramatically reduces the size of the skin's pores, which is what secretes that oil. And it shrinks them to 35 to 58%, so that way they're not as big, they can't collect dirt and dust. It also speeds up the skin's kind of metabolism process, the renewing process. Your skin renews itself every single day. There's 7 layers of the skin, including an acid mantle, and basically those move up every day. So it's basically constantly renewing itself. And a pimple can actually be there for 3 months before you, or it can be there for like a month before you see it, in 3 months, etc. That's why you have to wait a month or 2 of a new acne routine to see if it's working, because the skin has to take time to renew itself. Well, Accutane completely speeds that up so that stuff can't get clogged in there as easy. It just pushes it out immediately. It's also anti-inflammatory, like Advil, like ibuprofen. Basically, acne can be very, very swelling, especially the hormonal stuff. It'll like swell up, as you guys can see in the video. It happens to my face all the time. But that is really anti-inflammatory and will help bring it down. So yeah, I'm going to show you a list of the side effects and then read about 20 of them as fast as I possibly can. So this is something from webmd.com, which is Dr. Oz's little website. I'll show you guys. So here it says Accutane oral. That's what we're talking about. We have all these: severe, less severe, less severe, 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 less severe, less severe, less severe. So I don't even know how many that is, but it is a lot, and I'm going to read a couple of them to you as fast as possible, just for the sake of being funny, and we'll see how many times I slip up on my words, because I tend to do that all the time. Looks like I'm going to have to sit right here, so that way I can read. All right, ready? Should I read the severe ones or the less severe ones? How about the severe ones? Because that sounds, I don't know, just scary. All right. Depression, aggressive behavior, productive seborrheic. What the heck is that? Okay, let me try again. Depression, aggressive behavior, prosuctor seborrheic, cataracts, decreased vision at night, corneal scar, pink eye, sudden blindness and pain upon moving the eye, regarding the ears, hearing problem, stroke, obstructed a blood vessel by a blood clot, Accutane infection of the nose, throat, or sinus, biofascism, inflammation of the gums, hemorrhage from the gums, ow, ulcers of the esophagus, inflammatory bowel disease, hepatitis, A, B, or C. Hepatitis, Accutane inflammation with acute inflammation of the pancreas. That's like an acute triangle. They're the cute ones, so they're small. Geomicroleplius, blood urine, urine toxic neurolysis, Stevens-Johnson syndrome, decreased pigmentation of the skin. Oh, that's not good. Inflammation of the tendon, serious muscle damage that may lead to kidney failure, muscle pain, osteoporosis, decreased circulation of density of bone, premature growth of plates and bones, osteogrowth, seizures, visible water retention, fast heartbeat, swollen lymph nodes, stomach cramps, high amount of uric acid in the blood, high blood sugar, elevation of proteins in the urine. Oh, does not sound good because I can kill your kidneys, yo. Life-threatening allergic reaction due to allergy, high amount of triglyceride in the blood, anemia, decreased blood pellets, deficiency of glycemia is a type of white blood cell, decretion of nephroptosis, a type of white blood cell, mood changes, mental disorder with loss of normal personality and reality, having thoughts of suicide, sensitive to light, accumulation of fluid and tissue in the eyelid, irregular periods, itching, excessive hairiness, like I need more hair. Well, up here I do, but not like on my legs or my armpits. Trust me, I'm Italian. Not a good combination. Backache, drowsiness, dizzy. You didn't even hear my backache, drowsiness, dizzy, excessive sweating, weight loss, heart throbbing or pounding, nervous, impaired wound healing, not feeling well. Oh, not feeling well. That kind of sucks. Anyways, let's bring us back up to a normal little height here. Now that my mouth feels completely worked out, like it was on a treadmill for 3 hours, that's basically my little take on Accutane. Personally, I'm not a candidate, but I've heard so much about it that I have looked into it. So that's what I know about it. So please go research it for yourself if you think you need it. Know that there are a lot of things to be worried about. Some people say they don't, realize them at all. But basically, my personal opinion is your sebaceous glands are there for a reason. You're gonna need them in the future, for collagen, to keep your skin looking young. Why destroy them? If you can do absolutely anything else, hormone replacement therapy, even laser therapy, even though that does kind of break them down a bit, it's not as bad elsewhere on the body or on the inside of the body. So just try to do as much as you can to take care of yourself. Anyways, I love you guys. I wish you nothing but the best. Thank you so much for your support, your comments, everything that you guys have been doing to tell me about Accutane and Roaccutane and all those things in Brazil and France and America and Alaska and Hungary and New Zealand and Germany. Mwah, 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 mwah. I love you all. So thank you very much for recommending that. I am not a candidate, but I hope that this helps anyone else who is. And if you guys have a story about Accutane or Roaccutane, post a video or comment right now. Post a comment, say whatever you want about this video, but make sure that you do kind of a video thing on your experience or what you know about it. Post it as a video response to this video because I really want to see what it was like for you, because some people have a great experience, some people it's terrible. There was this one guy that killed his own doctor. I was like, dude. So make sure that you do that for me so that I can see, and thank you so much for all your love and support. I'll talk to you guys later. Bye.